Today I want to talk about the best treatment for poor erection or erectile dysfunction. Before I talk about the best treatment, you need to understand what is erectile dysfunction or poor erection. If a man is unable to initiate or achieve erection in a way that he will satisfy his partner, he has poor erection or erectile dysfunction. If you are able to initiate but you cannot maintain that erection for good performance, you have erectile dysfunction. If you are able to initiate and maintain but you're unable to satisfy your partner, you have erectile dysfunction. But if you cannot initiate at all, that's even the severest form. You see that they will initiate, but before they attempt meeting their partner, you see that the whole thing will collapse. Other ones cannot even initiate, and other men, what they have is that they don't have the desire and they cannot even achieve any erection. So, but before we talk about the treatment, you need to understand the causes of erectile dysfunction. Okay, some of these causes include diabetes, hypertension, problems with cholesterol, obesity. People that are obese, they will realize that their manhood is shrinking and their desire is going down. People that smoke, all these things affect a man's performance in bed. So, but what is the best treatment? If you want to treat erectile dysfunction, there are three ways in which you deal with it. First of all, you need to change your lifestyle. So you need to stop taking sugary tea, stop taking saturated fat. You need to watch the portion of food you eat and include vegetables and fruits in your diet. It is also important that you use other medications that will aid in your erection. There are medications that will open up the blood vessels of a man's manhood and allow him to have a good erection. There are certain injections that you can use on the manhood that will enable you to have erection, but those injections are only used when the tablets fail. In the severest form of erectile dysfunction or poor erection, you can also go and have surgery in which they will put a prosthesis for you, that is like an artificial manhood. But what is the best treatment for erectile dysfunction? The best treatment is to treat what is causing it. If somebody is hypertensive, it's good that you control your BP. If you're diabetic, it's very important that you control your blood sugar. If you have a problem with cholesterol, please treat it and make sure your cholesterol is normal. If you're smoking, please stop smoking. When it comes to testosterone, if you do not correct your testosterone, no matter the medication you're using, it will never work. So the best treatment for any kind of erectile dysfunction is to treat what is causing it.